So exercise has lots of benefit. Mostly with cardiovascular health. It's helpful if you have any clinical condition. It also helps in maintaining the health, also reducing body weight. So depending on the clinical implications we want, exercise could be beneficial. But at the same time, it also helps with reducing the inflammation that is caused by the different types of food we eat. These days we eat ultra processed foods, which causes like a chronic inflammation. So exercise helps in reducing that systemic inflammation in general. So if we have clinical implications, yes, exercise is helpful, but it's also helpful to maintain the overall health and well-being. So for those who don't know, gut microbiota is a very complex ecosystem that we have, not just in our gut, but also on the skin, it starts from the mouth itself. But we have the most populated microbes in the large intestine, specifically the colon region. And bacteria are about 97% of these microbes. We also have fungi, we also have viruses, we have archaea. And there are several factors that could affect this gut microbiome. It could be diet, it is the childhood immunity development that we have, it's the antibiotics you use. Age has a factor, being a man or woman has a factor of its own. And exercise also happens to be another factor that influences the gut microbiome. Depending on the type of the exercise, which is aerobic exercise or resistance training, it could have different implications on the gut microbiome. Also, the intensity with which the exercise is done, it again affects the gut microbial composition and its function. It definitely helps in adapting our body, which helps in improving the gut microbiome. Again, the relationship between exercise and gut microbiome is bidirectional, meaning if we have good microbes, few studies have shown that we would be more adaptive to the exercise-induced changes. And based on what type of exercise we do, it could also help in nurturing those good bacteria. So the bacteria that I mentioned earlier, they could be beneficial or they could be harmful, as you said. So depending on, for most of the cases, exercise has the ability to have beneficial effects. What our research shows is it depends on the BMI. So meaning if you have overweight body mass index or if you are obese, even if you do the same exercise, you might not be able to achieve the same beneficial effects as someone with a normal BMI. It does not have any bad influence, except if you are doing a very high intensity. Few studies have shown that if you are doing vigorous exercise only for like a short period of time, you might have higher bacteria that causes inflammation. It's called inflammatory bacteria, and this is mostly because it disrupts your gut epithelium, right? So in certain cases, when you do vigorous intensity exercise, it might be harmful, but if it is maintained for a longer period of time, our gut adapts to it, and then again, it does have beneficial effects. So far with other studies and also with ours, I would say moderate intensity is the best. And again, we did not do exercise, we did physical activity, because my research was on what are the implications of someone who does like a regular physical activity, which is walking to office, biking to office, going for a little hike, gardening, just the usual household chores like doing dishes or like mopping the floor. Then do they also have the beneficial effects? So when I say our study, it's the physical activity, and we saw that the moderate intensity physical activity definitely showed better results. And we also showed that the moderate duration, instead of doing for a longer period of time, doing it for 150 minutes to 500 minutes per week was the best. Yes, absolutely. Yeah, there is no question in that. People who have sedentary lifestyle, it's not just the exercise. Exercise did show some improvement in these individuals, but when it comes to gut microbiome, there is diet, there is genetics, there is lots of other factors that could play a role, right? So, for example, if someone is eating more protein in their diet in general, they have those type of bacteria. They have higher amino acid metabolizing bacteria, which we see in the athlete group. They have more of those versus non-athletes. They have more carbohydrate degrading bacteria. Dietary fibers, the bacteria loves it because that is their food. So the beneficial bacteria grows, and which helps in maintaining the overall gut health. The diet, I feel like diet just helps in the additive effects of the exercise that they do. They are already gaining the benefits of exercise, but diet just helps in making it better. So having a good diet and then also a good exercise regime is what helps in good microbiome.